In this week's Cardiology Countdown, we have two different imaging studies, interestingly both from the Mass General down the street, and then a fascinating study on the prevalence of severe aortic stenosis and implications for Tavr. So to begin with, we have a very interesting randomized study looking at imaging of inflammation. And patients with atherosclerosis were randomized to standard versus high-dose atorvastatin for a 12-week period. And there was FDG PET imaging of the carotid and thoracic aorta. And within 4 weeks, one could start to see a reduction in inflammation that ultimately was statistically significant at 12 weeks with just the high dose, and more reduction in inflammation with high dose as compared with standard dose statin therapy, about a 14% reduction with high dose and just 4% reduction with the standard dose. So a very intriguing study in 83 patients that offers a new insight into plaque inflammation and how we modulate that. The next study looks at a sub-analysis of the ROMI-CAT2 trial. And this was a trial of using coronary CT angiograms in the emergency department versus a standard emergency department evaluation with stress testing to evaluate the efficiency, length of stay, and then outcomes patients managed in those two strategies. Overall, there was a shorter length of stay and equal outcomes with the CT angiogram. This analysis focused on women that comprised about half of the study population. And all of the benefits on length of stay, et cetera, were seen. Women tended to have less often obstructive coronary disease that was seen, just 5% of this population versus 17% of men. But they found that this reduction overall pertained to women because they were a lower risk population. And so this really reminds us that CT angiograms in the emergency department for chest pain can be a very useful and expeditious way of evaluating patients, especially women who are lower risk in this setting. Then the number one pick I have is interesting estimate of the prevalence, I think, of aortic stenosis and the implications for Tavr. This is certainly at our major centers that do Tavr, a growing number of the patients that we see, and often when on service debate, am I just going to get another admission for this? And you know, a lot of patients being sent from all over. So a more formal analysis looked at about 9,000 subjects across 7 studies and determined that severe AS had a prevalence of 3.4%. And so when they extrapolate out to the populations of the United States and Europe, the estimate is that approximately 290,000 patients have severe AS and would be candidates, and each year 27,000 new candidates graduate into this category of severe AS. And so it does speak to a very high burden of disease where we may be seeing more and more Tavr and of course also surgical AVR. So for this week's Cardiology Countdown, I'm Chris Cannon.